Hello and welcome to the Botanical Biohacking Podcast. We have an incredible 8-part series combining the perspectives of a doctor of Chinese medicine, a doctor of Western medicine, and an herbal pharmacologist. By combining these vantage points, we get unique insight into the nature of pain and what the strategies we can use to overcome chronic pain and fatigue. And this is something we see all the time with fibromyalgia, chronic fatigue syndrome, irritable bowel disorder, basically a lot of the chronic disorders which have been associated with pain. We find that these pains are speaking to us. And by looking at the herbal pharmacology, by looking at the perspective of a very experienced MD and from yours truly, a doctor of Chinese medicine, we can really unlock the keys to what the body is trying to tell us. There are whole categories of formulas in Chinese medicine that work for regulating prostaglandins and platelet adhesion. And today, Dr. Tom Whalen will be with us explaining how some of these formulas are working and a little more about the nuance behind them.
This family of medicines works in multiple ways to alleviate pain. I'm sure that many of you out there have sprained your ankle. And when you sprain your ankle, it hurts. Your ankle swells up. You get discoloration from the blood stasis, platelets sticking to each other in the area of the sprain. The nerve endings become very sensitive. All those things can contribute to the pain, the swelling, the decreased blood flow that is limited in removing damaged tissue from the area, creating a cycle that, if left unchecked, can lead to some of the pain that people with fibromyalgia, chronic fatigue, feel on a regular basis. Now, this family of herbs, this collection of different herbs that make up these formulas have a number of different actions. They tend to inhibit prostaglandins and interleukins, which are chemical mediators that cause platelets to get sticky. You need the stickiness a little bit to prevent massive leakage of blood out of cells, but too much platelet stickiness prevents the blood flow that we talked about earlier. It also acts at receptors called tumor necrosis factor receptors, which in part mediate the blocking of pain signals. Studies with these families have shown that they don't provide as much acute pain relief as morphine does, but when used chronically, they alleviate pain much better than morphine in laboratory animals. And this is probably a result of not affecting the opiate receptors that very quickly upregulate when they're exposed to opiate pain medicines and the opiates become less effective. Another action that they have that helps to minimize pain is that they stabilize nerve membranes and minimize the movement of calcium ions across cell membranes. What happens with pain sensation is that a signal is sent from the area of tissue damage to the spinal cord, and at the place where the first nerve ends as it enters the spinal cord, it sends a chemical signal to the next neuron that then goes all the way up to the brain. that place where that chemical signal is transmitted is amplified if there's extra calcium released. So the first signal comes in, calcium gets released, and then the second signal has an even greater effect on transmitting pain sensation, while this family of herbs blocks that release of calcium. It also has effects like glucocorticoids to help minimize pain. It also has effects that are separate from glucocorticoid mechanisms. Glucocorticoids initially are an anti-inflammatory to help to decrease swelling in an area, but if left unchecked for long-term, glucocorticoids have adverse effects on cell metabolism, blood sugar levels, etc., where this family has an initial glucocorticoid effect that is then balanced by a non-glucocorticoid effect to minimize those adverse effects. So we have a group of herbs that affect pain and swelling. It also, I failed to mention, it also affects nitric oxide levels. Nitric oxide causes a significant increase in vascular permeability. So initially with an injury, we need some of the factors that are inside the blood vessels to migrate out to help to heal the tissues. But once that has happened, ongoing vascular permeability and the swelling that occurs with that decreases blood flow to the area and begins to have an adverse effect on tissue healing. That's why we're always told to raise our ankle, and sometimes we're told to put ice on it. That putting ice on a wound, sprain, is a bit of a double-edged sword. The factors inside this family of herbs help to regulate the release of nitric oxide much more naturally, so that the nitric oxide levels begin to ebb as the healing takes place. As the swelling goes down, blood flow into the area can improve, damaged tissues can be removed from the area, and healing can continue to take place. To my knowledge, we don't have any single medicine in Western medicine that has all of these effects. To get all of these effects, you might need to use a combination of aspirin, gabapentin, prednisone, morphine, and using all those together is like using a 1,000-pound sledgehammer to drive in an 8-penny nail. You can drive the 8-penny nail in, but it's a bit of overdue.
That is excellent. Something that tends to happen when using this formula of herbs or using herbal foot soaks is, as it's being used for pain, many people report a day or so of increased pain, followed by the pain dropping far lower than it was before. From your experience and from your perspective, can you please share some insight on why this may be happening?
If you put a tourniquet on someone's leg and cut off the blood supply to the area, the tissues in that area will very quickly become damaged, and things that are reactive oxygen species, free radicals, that are known to cause tissue damage build up in the tissues. Because you've got a tourniquet on the area, those free radicals are restricted into that limb. If you then take the tourniquet off after 6 hours, 12 hours, you then have blood returning to the area, and all of those damaging chemicals, those free radicals, are released from the tissues and then travel to other organ systems. They travel to the kidneys and have adverse effects. They travel to the liver and have adverse effects. They travel to the brain and cause fevers, increase sensitivity to pain. They travel to the spinal cord, causing increased sensitivity to pain. So it's something that anytime you increase blood flow to an area that's been damaged, you need to expect a washout phase where the damaging chemicals that have built up are going to be distributed through the rest of the body.
One of the precautions with using these type of formulas is that if they're taken before sleep, they can interrupt sleep cycles. Based on the pharmacology that you've seen, is there a reason from your perspective that this may be happening?
One of the things that we're starting to understand about sleep is that there's a chemical called orexin that is sort of like a small weight at the balance point on a seesaw. If you have sleep on one side of the seesaw and wakefulness on the other end of the seesaw, and you have a weight at the balance point, if you move it just a little bit one way or the other, it tips the whole system in one direction. And orexins are very sensitive to factors such as tumor necrosis factor, interleukins. I would expect that that's the place that it's working on that system.
Excellent. Within Chinese medicine, this type of formula family and the indication or suggestion that it may be caused by platelet adhesion is that there is sharp pain or a feeling like they're bruised in that region. Is there any overlap with Western medicine as far as specifically what a sharp pain may or may not indicate?
Oftentimes in Western medicine, sharp pain is looked at as being injuries in the area of ligaments and tendons attaching to bones. So I'm not sure if there's overlap there, but that's the place that people usually talk about sharp pain. If it has an electrical quality to it, then it's moving over into the area of direct nerve impingement. But for sharp pain by itself, I think more of those connective tissue places that have been injured.
That's interesting. They say that the tendons, the blood nourishes the tendons, and for tendon injuries, almost invariably this formula of families is used. And the concept is that by using this formula, it can help with alleviating this particular type of pain. I've seen some studies on prostaglandins influencing nitric oxide and nitric oxide influencing prostaglandins and nitric oxide influencing tendon and fascia elasticity. So that's my best guess as to where the overlap may be.
Right. With one of the things that I think is underappreciated in Western medicine is the chronic microtraumas that occur to ligaments and tendons. And ligaments and tendons have very few blood vessels per cubic centimeter. Probably the lowest density of blood vessels of any tissue in the body. So when they are injured, if there's even a small amount of platelet stickiness that decreases blood flow to the tendons, it really severely limits their capacity to heal. One of the things that is often talked about is tendinitis, and itis means inflammation. And when you look at tissues under the microscope, things that are being called tendinitis, there actually is rarely any inflammatory cells, and that's because the blood flow is so poor the inflammatory cells can't get there to begin the healing process. So the microtrauma just continues unabated, and unfortunately there are many, many pain-sensing fibers in the areas where ligaments and tendons attach to bone. So these micro tears cause a lot of pain.
That's fascinating. A precaution with this family of formulas is that they're not to be taken when people are in the midst of a common cold or if they have pain that's associated with some kind of infection. The concept in Chinese medicine is that this will draw the infection or pathogen that's coming from outside the body. In ancient times, they had an idea that these were tiny bugs floating around on the wind. So not exactly accurate, but close. The idea was that by increasing circulation, it would draw them inward and allow the pathogens easier access into the body. Based on the effects on inflammation, do you see any overlap between this traditional contraindication and infectious diseases?
Well, what's going on with infectious diseases is that there are some factors released within the body that are aimed specifically at combating the infectious pathogens. So some of the interleukins, some of the tumor necrosis factors are specifically geared up to battle off external pathogens. If we have a formula that is gearing these factors down for tissue healing in the body, it's going to be working against fighting the infection.
That's interesting. So both from a traditional and modern standpoint or biomedical standpoint, it seems to be very harmonious.
Yeah. I can hear the music playing now.
So generally, these first 4 stages are used to remove what's considered a state of excess, which means it's more that something is stuck in the body than anything is actually lacking. It's kind of like washing the cup before you fill it again. That's why traditionally these are seen to first, and then afterwards therapies which are seen to nourish the body follow this. It's not always the case, but overall as the strategy, the concept is you want to untangle it before you give it a boost. In the next 4 stages we'll be going through, they're classically seen to be boosting things like qi and blood and yin and yang. So as we go through the pharmacology of the formulas, we can really start to get a more in-depth look at what these concepts really mean, so that we can use the strategies and the concepts more than the tools themselves. Because ultimately I believe that there is no such thing as Western medicine or Chinese medicine. I believe that there's just medicine. And the more we can understand about both, the more clear our vision can be, the more sound our strategies can be, and ultimately the more effective we can be as people taking care of ourselves and each other.
And echoing a bit of that, it's all medicine. One of the things that is not emphasized as much in Western medicine as it is in Chinese medicine are other things that can be used as medicine, specific exercises, specific breathing techniques, dietary changes, warming or cooling foods that are never taught in Western medical schools.
Not for a few hundred years anyway, since they tossed out the idea of humors.
Exactly. And yet, all of those things are medicine in some form. And to ignore their efficacy and their importance is to go into a fight with 2 arms and 1 leg tied behind your back. Good luck.
Unless insurance is paying you to do that, then that's the right answer.
Ka-ching.
All right, that concludes today's episode, and next we're going on to the next one.